My dear students, welcome to class. This is a 53rd live virtual program. അല്ല ഫോട്ടോ എടുത്തിട്ട് പോ ലഞ്ചാവുന്നല്ലേ Very good evening, very good day to all my dear students who are all on this virtual platform. This is our 53rd live virtual presentation session from our B-GHUD Academy. It's me, as you all know, Abhilash Vijay Mohanan, the faculty from B-GHUD Academy. I hope all are doing good. Everyone is keeping safe, staying healthy, fit, fine, and all. Okay, I'm here to inform you one glad news too. So we are blessed with a lot of results. We've got abundant results in abundance. All of our students have got passed. We have got 100% success for our past examination. Okay. So I just welcome you all, those who wish to join for class, come and join and have your results with a great grace. Okay, so by next year, this time, you all can fly into your dream destinations and can settle well in your dream countries. Okay, English speaking countries. Once again, welcome you all. So let's not face. Let's move into the topic now. The question will be displayed right there on the screen. See, I want to tell you one more again and again, all the time. I'm just telling you the same. These all are examinated topics, examinated questions. You can have a quick look onto all of these things. You can just refer, you can save it for your reference, you can share it among your friends, those who are in need. Okay, so make it that and ask them to come and subscribe. Do subscribe and like it and do support us with your comments. Okay, you can put your continue suggestions in the comment box. Okay, we are always ready to help you. You can throw your concerns, your queries, your doubts. We are always here to help you. Okay, taking care of your students is our pleasure. So that is our motto. Yes. So now let's have a look onto these questions. All these questions are really exam-related questions. You can have a look onto all these things before going exam. Just have a reference. Go and uh, okay, go and just get give a good presentation and come with very good score. Even you can fetch an A band if you go with thorough practice. Okay, so wish you all once again all the good luck. Let's move into the topic. Here comes the question. The question is displayed right there. Okay, setting is a community health center. You see a 35-year-old patient who is going on a trip soon and needs to take malaria medication. Concerned about taking this medication, as has suffered from depression in the past, and has read that there is some like find out relevant details about trip. So we need to collect more details about the trip, like length of visit, whether it is a rural or urban area. Okay, recommend doxycycline for malarial prophylaxis. So we can recommend doxycycline for the malarial prophylaxis. Okay, because there is no contraindication for patients with history of depression. So we can frankly use this medication. There is no restriction or contraindication for this medication in the case of depression. Fine. Give details of the dosage. So we need to give the dosage like 100 mg daily with food. It should be started 2 days before trip. It has to be continued during trip and 4 weeks after return. So the course is such a long course, 100 mg daily with food. It should be started 2 days before and has to be continued during the journey and should finish only after 4 weeks of their return. Okay, so this is how you should make the sentence. Stress need for both medication and bite prevention measures. At the same time, we need to stress the importance of anti-bite measures too. Okay, along with the medications, they need to adopt certain anti-bite measures too. That also we need to explain to the patient. Fine. Like they are visiting high risk area that for a long time. Okay. Give reasons for long dose of doxycycline. So the patient may question the long dose of doxycycline. Why is it so? So we need to explain that allows time for multiplication of parasite. Okay, so this long duration means this multiplication of parasite can happen at any time. So such a long course will prevent each and every chance of getting contracted with malarial parasite. That's all. Okay, find out reason for patient's reluctance to take medication over long period of time. So the patient would be showing some sort of hesitance and reluctance in continuing with the medication. So we need to explore the reasons behind that. Right. Next is like give details of possible side effects. Okay, the patient would be afraid of side effects. We can give the details of side effects like heartburn can happen, upset stomach. It may increase the risk of sunburn if exposed to sun. Okay, this is all the side effects that the patient could happen, may experience. Okay, and warn the patient of risk of not taking medication if malaria is contracted. So at the same time, we have to ask them avoid, okay, get devoid of all those thoughts. Instead, they should think about the possible complication that could happen in case if they are not taking patient getting contracted when gets contracted with malaria, so what are the complications they have to undergo? Because they can go for heart, kidney problem, and also these are serious complications. Finally, we should explain all these things, and we need to convince the patient somehow to go for this medication. Anyway, they will get convinced, but we need to explain all these things in a polite manner. Fine. Okay, I think the question is clear. So if you have got any queries or any doubts or any questions or any questions to discuss in particular, please to send it to our comment box, suggestion box. We'll be always happy to help you. Okay, so now if you're having any concerns, you can do the same. So let's move into the discussion. So as I told, this is a fresh case, first time case, unknown case. Okay, the patient is totally a stranger. You all know how to start the talk. Good morning. Can ask like, good morning, please come in, have your seat. Okay, so this is a community health center. Sort of any sort of inpatients or any admission is not possible. It's not applicable in that situation. So we can just start like, good morning, please come in. Okay. Good morning, please come in. My name is Abhilash Vijay Mohan. You can say like, my name is Abhilash. I'm the nurse in charge. Okay, or nurse working or the same nurse or the registered nurse, whatever it is, because no role is specified. Good morning. You may please come in, have your seat. My name is Abhilash. I'm the nurse in charge. Okay. How may I help you? Okay, what can I do for you? May I know the reason for your visit? Okay, how can I help you? What can I do for you? Okay, what is the reason for your visit? May I know the reason for your visit? How can I help you? Whatever it is you can do, like, okay. You should be saying, like, nurse, I'm here to ask you more about malarial medication since I'm leaving for trip next month. Okay. He said, I see. Surely I will help you. He said, oh, I see. Surely I will help you. Yes, surely I help you. Okay, like that. Okay, or I see. Surely I will help you. Or is it? Surely I will help you. Okay, so before moving into detail, can I have your basic details, please? Your name, age. Okay, so they will be giving you the name and age. Fine. How long is the trip for? Okay. So I can ask, like, shall I ask you a few more questions related to your trip? Shall I ask you a few more questions related to your trip? Okay. So they'll be saying, like, sure, Naz, you can ask me. How long is the trip for? Okay. So, like, how long is it for? Okay. How long is that trip for? Okay. So the patient would be saying, like, it is there for almost a okay, so that will be there for almost a month. Is a visit to a rural or an urban area? Is visit to a rural or an urban area? Is the visit to a rural or an urban area? Like, what is the area of your visit? Is it rural or urban area? Is a visit to a rural or an urban area? Or what is the area of your visit? Is it rural or urban? Either of this way you can ask the question. Okay. So they will be saying like they will be giving you the explanations. Fine. Okay. Could you elaborate on your travel and other details? Could you elaborate on your travel and other details? Okay, could you elaborate on your travel and other details? Okay, so do you have any concerns regarding going for this medications? Do you have any concerns regarding going for this medication? So the patient would be definitely describing the episode of depression and all. Okay, so their concerns and well, thank you for answering me the questions. Okay, thank you. Well, thank you for answering. Thank you for answering me, Martin. Okay, thank you for answering me, Martin. Now the situation is now it's a lot more clear. Now the situation is a lot more clear. And now it's a lot more clear. Well, okay, I could recommend you tablet doxycycline for your malarial prophylaxis. Okay, I could recommend you after analyzing all the details. After analyzing all the details, I could recommend you tablet doxycycline for your malarial prophylaxis. Okay, this medication is safe and effective. It has been used in clinical practice for many years. So there are no restrictions or contraindications even in the history of depression. There are no restrictions or contraindications even in the history of depression. You can take the medication. It is really safe and effective. Okay, it is really safe and effective. All right, understood. So they'll be saying, the case now I'm getting you. I'm getting you. What about the dosage they will? asking you. Okay, so when it comes to dosage, it is 100 mg daily. It is available 100 mg daily. Okay, the tablet dosage is 100 mg daily with food. Okay, it is available in 100 mg daily and has to be consumed with food. It is available in 100 mg and has to be continued and has to be taken along with food and has to be taken along with food. Okay, it has to be started 2 days before your trip. Okay, it has to be started 2 days before your trip and okay, and should continue during the journey. It has to be started 2 days before your trip and continued and has to be it should, okay, it has to be started 2 days before the trip and should be continued during the journey. It has to be started 2 days before the trip and should be continued during journey. Okay, and you can finish the course even you can finish the course after 4 weeks of your return, and you can finish the course after 4 weeks of your return. It should okay. It should be started 2 days before, or can start it 2 days before the trip. Okay, you should start it 2 days before the trip and has to be continued during the journey. It should be started 2 days before the trip and has to be continued during the journey. You can finish the course or after you can finish the course after 4 weeks of your return. You can finish the course after 4 weeks of your return. I hope you're getting me. Any doubts? Do you want me to repeat it once more? The patient will be saying, no, nurse, it's almost clear, but are there any other things that I should do along with it other than this medication? See, taking medication is a must. 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 Along with that, right? Okay, along with that, you need to adopt bite prevention measures too. Along with that, you need to adopt bite prevention measures too. You can use creams, emollients, lotions, mosquito repellents, okay, protective clothing, hats, okay, mosquito mats, okay, all those things that you can use to prevent mosquito bite. Fine, okay, you need to adopt anti-bite measures too, or bite prevention measures. Okay, since you're visiting high risk area, that too for a longer time, it would be more safe. Since you're visiting to a high risk area, since you're visiting, since you're visiting a high risk, since you're visiting a high risk area, that too for a longer time, it would be more safe. Okay, that assures your safety. Okay, it would be more safe and that assures your safety. It would be more safe and that assures your safety. Understand? Um, so they will be asking like, oh nurse, I'm really not. Why such a long course of doxycycline is prescribed, nurse? I'm not getting that. We can. I understand. I know why you're feeling this way. See, the long course of doxycycline is to prevent the spread and multiplication of malarial parasite. Okay. See, such a long course of doxycycline has been prescribed to prevent the spread and multiplication of malarial parasite. Okay. It can happen at any time. So, with this long course, we can prevent the spread and multiplication of malarial parasites. That is the reason why that's for the sake of patient safety. It has been prescribed for such a long course. So it is for your safety. You don't have to worry. So the patient would be again saying like, oh nurse, I don't feel like taking. What happened? What happened? Why are you hesitant? Why are you reluctant in taking this medication? Well, what happened? Why are you hesitant? Why are you reluctant in taking these medications? Is there anything bothering you? Please tell me. Let me hear. Please tell me. Let me hear. So they will be saying like, oh nurse, I'm really very worried about the side effects and all. No, nurse, I really don't know about all those things. I agree with you. So we need to tell like, I agree with you. I agree with you. You're right. I agree with you. Right. There are some side effects. There are some side effects. You may have, you may experience heartburn, upset stomach. Okay, and the risk of sunburn is also more while consuming um, doxycycline medication. Yes, you're right. I agree with you. There are some side effects that you may experience, like heartburn, stomach upset, and it may also increase the risk for sunburn. Okay, it may also increase the risk for sunburn. Okay, during consumption, it may increase the risk for sunburn. So these are some side effects, but you don't have to worry. But you don't have to worry. These are just minor. Okay, these are not too serious, just minor. These are not too serious, just minor. You don't have to worry. These are not too serious, just minor. Okay, it is manageable. Okay, it is manageable. There are many ways by which we can manage the things. Okay, so you should think of but you should think of the potential benefits that you could enjoy long term. You should think of the potential benefits that you could enjoy long term. But you should think of the potential benefits that you could enjoy long term. So they'll be asking, what is that? See, Martin, in case if you are not okay, see, Martin, if you are not taking the medication, okay. See, Martin, if you are not taking the medication, and it means if you're getting contracted by malarial parasite, see, see, Martin, if you're not taking the medication, in case if you get contracted, okay, in case get contracted, okay, if you're not taking the medication, contracted by malarial parasite. See, Mr. Martin, if you're not taking the medication and get contracted by malarial parasite, um, that can result in some serious complications. That result in some serious complications. There'll be the what? Say malarial infection. Okay, malarial attack may result in heart and kidney problem. Malarial attack may result in heart and kidney problem, which are very serious. Malarial attack may result in heart and kidney problem, which are very serious. These can be life threatening too. Okay, these can be life threatening too. So you think about it. Okay, which one is safe? So you think about it, which one is safe? Okay, so they will be saying like, is it nest? Yes, you're likely to develop some serious complication if get contracted or if it gets affected by malaria infection. Are you getting me? Malarial infestation, parasite infestation. Okay, malarial infection or infestation, you can both you can use malarial infection. Are you getting me? So it would be always fine to get updated with the malarial prophylaxis. So it would be always fine to get updated with malarial prophylaxis. So it would be always fine. So it would be always fine to get updated with the malaria prophylaxis. I strongly recommend you that. I strongly recommend you that. I strongly recommend you that. What do you say? What do you say? They will be saying like, okay, nurse, if that is the case, means I don't have any other say. I'm ready to go for this medication. Great, glad to hear that. Okay. Great, glad to hear that. Your decision is wise, and that is going to ensure your worry and no free trip. Okay, your decision is great. That is going to ensure you a worry and a worry-free trip. That is going to ensure you a worry-free trip. Okay, you can definitely enjoy your journey and can make things possible. You can definitely enjoy the journey and can make the things possible. Okay, you can get the prescription from the pharmacist. You can get the prescription from the pharmacist. You can get the prescription from the pharmacist. Okay, they will get it filled for you. You can get the prescription from the pharmacist and they will get it filled for you. Okay, so take it and ensure a happy journey. Ensure happy journey. So by that, we are going to finish the I wish you a happy journey. Again, should um, and take that and ensure a happy journey. Okay, I wish you a happy journey. Okay, do you have any other queries for me? Okay, do you have any other queries for me? So they'll be saying like, no, Nas, thank you for giving me all these details. I'm very happy in having a talk. Okay, thank you once again for your visit. Thank you for your visit. It was really a pleasure talking to you. Wish you a happy journey. Come back safely. Okay. Thank you once again. Thank you for the visit. It was really a pleasure talking to you. Okay, wish you a happy journey back safely. So by that, we are going to end the conversation. So that is the perfect way by which we can end up conversation or speaking. Okay, our chat with the person who is about uh, go for a trip. Okay, hope the question, the way of discussion and all is clear for you. If you to refer this, read this, hear this, take notes, never by heart, just practice it. And I don't want anyone to by heart this, mug up this, hear the thing, listen the thing, write the notes, okay, and practice by yourself. You need to develop your tone, organization, everything in a natural way. You need to give up your conversation. Okay, you need to give your conversation. So all the very best wishes for my dear students who are watching me. So share it among those who are in need. Okay, and contact us if you wish to join. Okay. God bless you all. See you for the 41st section by next Friday. Till then, take care. Bye.